Hello, my name is Dr. David Markowitz, and I'm here to talk to you a little bit about how we got our office sorted using Sortly. Now, a lot of you are probably wondering why the heck a dentist is going to talk to you about organizing your dental supplies, and that's a very good question. Why do I care? Why the heck would I care so much about supply organization and ordering that I would put together a PowerPoint presentation about it? Well, for one, in dentistry, there's so much that always seems out of our control. We can never fully control how a tooth will react to treatment or if a patient will show up to their appointment on time. We can't control when glitches will show up on our computer system or when a temporary will fall off. Oftentimes, pretty much everything feels just out of reach, just out of our control. However, there are a few things that we can completely control. One of those is making sure that we have the correct materials and supplies in our office. And by having these properly organized within the office, promotes a palpable sense of calm and cleanliness that is felt by both you, your team, and most importantly, your patients. So if you can completely control even this one seemingly mundane part of your practice, I think it frees up your attention to focus on more important areas that have to deal with patient care. So, outside of that very poetic reason for caring about ordering, money is also a great motivating factor. Dental offices spend a lot of money on supplies every year. It's estimated that most general practitioners spend about 7 to 8% of their overhead on supplies. Typically, general practitioners spend the most money on supplies, while specialists tend to spend a little bit less, with endodontists actually being the lowest of the bunch. But regardless of what type of practice you run, my accountant has confirmed that if you cut your spending on supplies, you can save money that can eventually be invested back into your practice. So saving money is always a good thing. Prior to getting sorted, our supply ordering was completely out of control. In 2021, we spent roughly 8% of our overhead on dental supplies, and it felt chaotic. So in 2022, I decided to organize the way the items in our office were stored, and I implemented a new inventory system in hopes to gain a little bit of control over our spending. By merely organizing and implementing this new system that I'll go over with you, we saw the amount of money we spent on supplies get cut in half, nearly half. It went from 8% down to 4.5%. And this was all done without changing dental suppliers. We weren't shopping deals. We weren't looking for discounts. It was all done merely by organizing, cataloging, and reducing waste. So before the system was implemented, when we were spending 8% on our supplies, this is how we did it. Typically, I would give one of our assistants a credit card, and I would told her to keep us stocked on supplies. And that was the extent of the direction I gave her. She would then order a few times per month based on what she thought we needed. Often she would see a little promo offer, something like buy 75 heavy body cartridges, get one free, and she would get that thinking that it was the best deal. But when the shipment came in, whoever answered the door would then just open the box, and they would be the one to put it away. And they would take that heavy body, the 76 heavy bodies that we got, and she would put it where it's usually stored. However, since she bought too many of them, there wouldn't be enough space to keep those all in that one spot. So then they would go ahead and put it in some other random room where there was space, and they'd swear they would remember when the heavy body ran out that they had some in there. It would always happen. When we would run out of supplies, it'd be at a very inopportune time, exactly when we needed it. And then we'd freak out. We would spend a bunch of money to overnight ship that heavy body to come back to the office. And then about 6 months later, we would open up that other cabinet and realize we already had a bunch of heavy body, but now that heavy body was expired. And so, I mean, it's kind of a roundabout way of saying it, but we used to order supplies in a way that was extremely efficient and wasteful. And so we decided to start using a system called Sortly. Sortly is an inventory management software, and although it's not made specifically for dental offices, many of its features are completely applicable to what we needed. Sortly has both a desktop and a mobile app version that makes it easy to use and implement within our office. Sortly's pricing, I know you guys are going to ask about it. It's tiered, so it's based off primarily the size of your operation. For the vast majority of dental offices, you're going to fall into that advanced category, which is $29 a month. You can have up to 2,000 individual items cataloged under there. So it costs us roughly $348 a year for the Sortly software. So unlike most things in dentistry, cost is not the issue with the system, and I'll explain to you kind of what the issue or the barrier for entry might be for a system like this. So at our office, we have an old iPhone, one that I found in my drawer, probably something I used back in high school. And it now sits in our lab, it's plugged in, and it has one app on it, and we call it the Sortly phone. Any employee has access to this Sortly phone. If you open up the Sortly app on the phone, you'll see that all the items in our office are organized based on the room that they're stored in. So if you click on any of those rooms, you can see all the items that are stored there. And then if you click on any of those items, you can see very specific details of what item, including the exact name, where it was ordered from, how much to order, and what the typical price is all listed there. You can also see other notes that might be added in there by assistants or other team members. I'll show you how that plays out in a minute. So the most important thing for us is we made sure that every item in our office has a home. Benjamin Franklin once said that a place for everything and everything in its place. And that's how our office works. If a room is out of stock on a certain item, let's say it's Profi angles, then the employee can go to the Profi angle home, grab a handful of Profi angles, and then restock their room. When that home is empty, we know we're ready to reorder that supply because we know that there's still some supplies left in those other rooms from when they stocked it. And if anyone doesn't know where an item is stored, they can easily open up the Sortly app, click on the search bar, and type in the item they're looking for. It'll tell them exactly what room that item is kept in. This has been super helpful, especially for new hires, people that are trying to learn their way around the office. And it also is helpful for team members who are looking for items in spaces that they're not used to operating in. So for example, like last week, we had a business team member got approached by a patient who said they wanted to purchase some whitening gel. Instead of coming to interrupt the assistant and the doctor in the operatory, the business team member just pulled out the Sortly phone, typed in whitening material, and she was able to see exactly where it was in the back lab, and she went back, grabbed it for the patient, didn't have to bother anybody else along the way. So it adds a certain level of efficiency there when looking for things. At each item's home, there is a corresponding label and QR code. Now, when I created these QR codes and these labels, I use the exact wording from the supplier that we purchased that item from. This way, when I go to order supplies, and I'll show you how I do that, I can literally just copy and paste that exact name into my supplier's website, and the exact item that I normally use will show up, and I can reorder that. We have these QR codes all over our office. The QR codes are typically visible on clear storage bins. Nearly all of our storage bins now, both inside and outside of cabinets, are clear because I find that using clear storage bins makes it much easier to identify when an item might be running low or out of stock. If you have a bin that is not clear, everything in it remains hidden unless you open it up. And so having those clear bins just makes it way easier to keep track of what you're fully stocked on and what you're low in stock on. So if you go ahead and you find one of those QR codes and you scan it, it'll take you directly to the page for that item. On that page, we have inputted some essential information for it. So first, it shows me the typical price for this item. It's the supplier we normally order it from, as well as the maximum order. One of our main goals with the system is to avoid over-ordering. Our team knows that if it doesn't fit within its home, we return the extra. We completely avoid storing extra items that were bought in bulk in random sites within the office. If an item is not stored in its home, it gets lost, it creates disorganization, and it usually leads to unnecessary waste. So having that maximum order number there, so you can see on that Profi angle, it says maximum order 2 boxes of 200. That's telling me that when that item is out, I cannot order 3 of them, because if I order 3 of them, it is not all going to fit into its containers or into its storage bins. And then we're going to be left with a bulk extra item that needs to find somewhere else to be stored, and we do not want that. So if a team member notices that they use the last of an item or getting super low on an item, then they just pick up that Sortly phone and they scan the corresponding QR code and mark it as low in stock or low supply. Anything that's scanned is populated on our low supply list within Sortly. Once a week, usually do it the same day of the week on Wednesdays, I review the items on the low supply list, and then I also do a quick inventory check of the office while holding the phone. So if I notice something is low, so just scan, boom, and I do a complete inventory check. This whole process for the inventory check takes 5 minutes. So not a lot of time spent there. Once complete, I can then download an Excel sheet of everything on my low supply list. The sheet is complete with those exact names I was talking about, and also where to order it from, what the maximum order number is, and then also when they scan these items, the assistants or the team members can put in little notes for us if they want something different. So for example, one of my assistants, Jen, here under patient bibs, she hates that I always order the same lavender colored patient bibs and she wants a different color. Also, she noted something a little more important, that I've been using more opaque temporary cement instead of the clear temporary cement, and so she made a little note that I should order more of the opaque as opposed to the clear cement. It's nice to be able to review these notes because a lot of times the assistants do have a better handle on what materials are being used and when, and so they can give you little notes and indications based on what to order. So then I take that list and I literally sit down with it. I log on to our different dental suppliers and I add the items. By copying and pasting the names on the list into the supplier website, I know I'm ordering the same supply I have always ordered. Previously, we would reorder stuff like, let's say, Benda brushes. Our assistant thought she was ordering the same Benda brushes. Sometimes she would accidentally order like an 8mm diameter tip instead of the usual 4mm tips that we typically use. So avoiding these small issues, they not only save money by limiting waste, but also I think it improves a relative consistency within the operatory if you have the same materials that you know you want every time. I order supplies usually once a week, and we still use all of our different dental suppliers. We use probably over 10 different dental suppliers. That's like DHP, Benco, Bressler, Darby, Henry Schein, Dentsply, Amazon. There's a lot of different suppliers that we use. I don't know a single dental office that uses just one supplier. And so all I do is I log into those suppliers. I have all my logins saved on my work computer. I copy and paste and I put it in there. It usually takes me under 10 minutes to complete a full order each week. Then as an added feature, our office, we have Slack. So after I place that order, I send a quick note to the team in our supply ordering channel. And I just have a bullet point list of everything that I ordered that week, including the costs. It's my way of telling the team, don't worry, it's coming. So if they're worried that I didn't order something, they can check that to be absolutely sure. And then I put the cost in there just because I think when team members see how much we spend on certain items, they tend to waste less knowing the value of it. Then when these items are delivered to the office, whoever puts the items away knows that they have to scan the corresponding QR code when they put it away, and this takes it off of our low stock list. Now, I know the system is not perfect, but it's working for us right now. Since implementing this system, we have not had to compromise any appointment due to lack of supplies, which is great. Our team members know exactly where to find even the most obscure supply, and while improving cleanliness and organization, we have also reduced our spending by nearly 50%. On the way back to some of our operatories, patients often pass by our larger tip-out bin wall, and they comment all the time on the level of organization, so much so that our team now has a line they repeat back to the patients whenever they say something. The team members say, if you think our doctors are OCD about their supplies, imagine how they're going to treat your teeth. And so patients are picking up on this level of cleanliness and organization that we have within our office. Now, there definitely are difficulties with this system. While I mentioned that Sortly is relatively cheap, the real investment with implementing the system is the time and energy spent in cataloging all the items. When I started organizing, I did what my grandmother called Polish cleaning. I took out every single drawer, every item from every drawer, from every cabinet, cataloged it, and then put it all back in a correct order. I individually cataloged every item. I researched where we ordered from, I created QR codes, and I decided on where it should be stored or its home within our office. I did this in phases. I didn't do it all at once, but it took me many hours to work my way through the whole office. We have everything in Sortly, from dental burrs to hygiene prophy paste to printer ink cartridges and packaging tape. Everything in our office is cataloged. And unfortunately, I do not know how to make that time and energy investment less at this point. So I'll leave you with my favorite Benjamin Franklin quote that I mentioned earlier, a place for everything and everything in its place. I truly believe that a dental office that has a place for everything and has everything in its place makes for a more fiscally efficient and a generally clean office. For most dentists, ordering supplies is an afterthought delegated to someone who has the best grasp on where things are hidden within the office. This system takes away the guessing in ordering and organizes it in a way that can give you some peace of mind and probably save you some money along the way.